Hi, I'm Holly with Randall Mill Pharmacy.
I'm Patrick, I'm the pharmacy manager, and today we're going to be talking about breast cancer awareness. Okay, so before we actually get into breast cancer specifically, let's talk a little bit about what cancer is. Cancer is the uncontrolled growth of certain cells in your body. So your body has natural mechanisms in place to allow your cells to grow, but to grow within a certain limit. So cancer is when those limits are removed and you have a certain part of your tissue and cells that grow uncontrolled. And so in this video we'll be talking about breast cancer specifically. Now there are many different types of breast cancer. One you may have heard of is triple negative breast cancer, and we'll get into that in a little bit. And of course there are different stages of breast cancer as well, stage 1 and 2, and then in 3 and 4 the cancer can actually spread to lymph nodes and then spread throughout the entire body through the blood vessels.
Yes, and breast cancer widely impacts women and men in the United States. According to the National Breast Cancer Foundation, this year an estimated 276,480 new cases of invasive breast cancer will be diagnosed in women in the United States, as well as over 48,000 new cases of non-invasive breast cancer. So to sum it up, about 1 in 8 women in the United States will develop breast cancer in her lifetime. Although it is rare, men do get breast cancer too. In 2020, an estimated over 2,600 men will be diagnosed with breast cancer. Breast cancer, to sum it up, is the most common cancer in American women except for skin cancer. So some common terms that you may hear associated with breast cancer, we're just gonna touch on a few. To start with mammogram. Patrick, do you mind explaining what a mammogram actually is?
Sure, so a mammogram is just a screening test. It's actually an x-ray of the breast, and the doctor will go in and screen for any kind of lumps or skin irregularities. For women starting at the age of 50, it's routinely recommended, and it's a very important test to get done.
Yes. Another term that you may hear, and I think most people hear this one on the commercials that advertise for breast cancer treatment, is triple negative breast cancer. Okay, I'm gonna get like a little scientific here for just a second, but I'm gonna try to explain it the best I can. So think of your cells as a house, and the front door may have 3 different kind of locks, and those locks are called receptors. One is for the female hormone estrogen, the other is for the other female hormone progesterone, and the third is for a protein called human epidermal growth, or HER2. If the cancer has any of these 3 locks, doctors can use medications as keys, and if the cancer only has 3 of these locks, the doctors only have a few keys or medications that can work to treat those cancers. But if the cancer is triple negative, which is what we sometimes hear in the commercials, it means that none of those locks are on those cells. And so the doctors have fewer key treatments or medications available to treat triple negative breast cancer. But fortunately, in triple negative breast cancer, chemotherapy is still an effective option for that kind of cancer.
That's right. And there is also a genetic component to breast cancer. You know, genes control the growth of cells and also check the growth of cells to help prevent cancer. And a couple of genes that scientists have identified are the BRCA or BRCA1 and 2 genes. And there are tests available to check and see if your genes have the mutation that may lead to breast cancer. It's something good to talk with your doctor about and check those tests, just in case if you're at high risk or if you have a history of breast cancer in your family. It's always good to check all your bases on that. And lastly, one other risk factor for breast cancer is dense breast tissue, and that's how much glandular or fibrous tissue you have versus fatty tissue. And so more fibrous tissue tends to lead to a greater risk for breast cancer awareness. And more fibrous tissue may occur through younger age, through pregnancy, through hormone replacement therapy. Again, this would just be something to talk with your doctor and screen for with your doctor.
Yes. So getting into some of the signs and symptoms of breast cancer, different people have different symptoms of breast cancer. Some people do not have any symptoms at all. Patrick, do you mind talking about just some of the common signs and symptoms that one may show if potential for breast cancer?
Sure. Yeah, sure. So I think the one that everybody knows about is discovering a lump. And the lump may be in your breast, or it may also be in your underarm area, which would be a sign of like a lymph node, a lump in your lymph node. There can be changes in the skin of the breast, redness and irritation, or maybe even some flakiness. So anything that you would say is different in the nipple or breast area, and again, especially if you notice a lump, those are all signs to kind of watch for and definitely let your doctor know.
Yeah, and those are all warning signs associated with breast cancer, but keep in mind those can also happen with any other condition or inflammation or anything else that you may have going on. So it doesn't exactly always pinpoint to breast cancer, so it's best to check with your doctor if you have any of those signs or symptoms. Now more than ever, healthcare providers can treat cancer in different ways. Each individual's treatment depends on the stage of the breast cancer they have. Do you mind talking about some of the various treatment options available for breast cancer?
Sure, yeah. So, with most cancers in general, radiation and chemotherapy are kind of your go-to standards. But when it comes to breast cancer, if radiation and chemotherapy aren't necessarily working as well as they want them to, the last course of treatment would be a mastectomy. But even nowadays, if a mastectomy is required, or even if a patient chooses to have an elective mastectomy procedure, reconstructive surgery has really come a long way, and there's a lot that can be done to help even after a mastectomy is done.
Yeah. So while you usually cannot prevent cancer in general, it's important to be proactive about your health. Researchers have suggested that dietary factors could be responsible for 30 to 40% of all of all cancers. So some things to consider: just generally, make sure you maintain a diet of variety of fruits and vegetables, including salads, foods rich in fibers such as whole grain beans, low-fat milk and dairy products. Do you want to touch on some more?
Sure, yeah. So as always, it's very good to get regular exercise. If you're smoking, quit as soon as you can. One of these that is specific to breast cancer is actually breastfeeding. It's been found that women that breastfeed their children tend to have a lower risk for breast cancer. So if that's possible, it's something that's strongly recommended.
And another thing that Patrick talked about earlier was the BRCA1 and BRCA2 genes. If you have family history that's significant for BRCA1 and BRCA2, it's extra important for you to talk to your doctor about ways to lower your risks. So with mentioning lowering the risk of breast cancer, we're going to get into screening. Breast cancer screening means checking a woman's breasts for cancer before there are signs and symptoms of the disease. All women need to be informed about the best screening options for them. Although breast cancer screening cannot prevent breast cancer, it can help find breast cancer early when it is easier to treat. It's recommended that women who are 50 to 74 years old and are at average risk for breast cancer, meaning that they do not have a family history significant for breast cancer, get a mammogram every 2 years. And women who are 40 to 49 and same at low risk or average risk should talk to their doctor about their need for breast cancers and other ways that they can screen. So with still talking about screening, do you want to talk about self-screening?
Sure, yeah. So the most important thing with self-screening is to just know your body. I mean, if you know your body, you're gonna know if something's not right, if something's different, if a lump appears, if something, is not the way it's supposed to be. So regular self-screening is recommended, and there are various resources, on the internet to explain the procedure for a self-screen, but again, if you just know your body, then you're going to recognize when something is not the way it's supposed to be.
Absolutely. And like Patrick said, if you're unsure on how to properly give yourself a self breast exam, there are lots of YouTube videos out there. You can talk to your doctor. There's brochures available, all of that, to make sure that you're well informed. All right, well, I believe that about wraps it up for breast cancer awareness. If we didn't answer any of your questions or you need more information, there are tons of resources out there available to learn more on breast cancer, such as the CDC, the National Breast Cancer Foundation. You can reach out to Susan G. Komen. Just lots and lots of resources available out there. Don't forget to like this video, hit that share button as well, and also remember to like our page on Facebook. I think we're on Instagram too, right?
That's right.
All right, well, we'll see you next month.